Okay, we are live.
Hey everyone, welcome back to another virtual shadowing session. Today we have Dr. Allison, and she's a periodontic resident, so she'll be sharing what she does in her day, some cases, and any tips she may have. So thank you so much for joining us, and whenever you're ready, you can begin.
All right. Well, first of all, thank you, Fresh Dental Shadowing, for inviting me. I really appreciate it. And as I was telling you guys a little bit earlier, I think that this is such a great way to make sure you're still getting the most out of shadowing experiences. Obviously, with now things are opening up, so it's gotten better. But within the last year, a lot of you that were getting close to application time were probably a bit stressed to make sure that you fulfilled the hours that you wanted to. And I think that you all figuring out this way in doing so just shows that you have perseverance, and that's going to get you so far. So far in the field. So I just want to start off with saying congrats to you guys for working hard and getting it done, regardless of the circumstances. All right, so let's jump into it. So again, my name's Allie. I'm a first year. Well, I guess as of next week, I'll be a second year perio resident at Penn. So it's been a really good experience so far. And this is pretty much what's on the agenda for today. So I'll introduce myself a bit more to you all, talk about why I got into dentistry, and then why I decided to specialize in particular, what my role was like as a first year, and then we'll go over a case and some final thoughts. And any questions you guys may have, feel free to shout out whenever, or at the end is probably easiest in this format. But if you did want to interrupt, please feel free. Okay, so a little bit about me. I was born and raised in Miami, Florida. And I got my undergraduate degree at the University of Central Florida, so go Knights. And then I went on to go to dental school at NYU. And now, as you all know, I am at University of Pennsylvania in Philadelphia, pursuing a specialty in periodontics. And we'll get into all this a little bit more as we go through the presentation. Okay, so why dentistry? Well, first of all, I can start off by saying I didn't have any background in it to begin with. No family, no distant relatives, no friends even that were interested. It just never even crossed my mind, to be totally candid with you about it. So it was funny because when I finally decided, my family, everyone was just like, "What are you talking about? You've never mentioned this." But in any event, the way that I came to find that this made the most sense for me, and I'm so happy with this decision. Every day I wake up really happy with what I'm doing, is through organized dentistry. So what you all are doing, getting involved, exploring what the field looks like, and understanding what the day-to-day would be and what commitments you'd be making. So the first group I joined was the Pre-Professional Medical Society. And that's a club at UCF that kind of caters to everything. And so meaning pre-med, pre-dental, pre-vet, you name it, they're having everyone come in and speak to us. They're having different sorts of shadowing events or opportunities rather, in different clinics and different offices to give you an idea of what you can expect if you were to pursue that career. And then I went on to have the week where the dentist came in, and I was a first year or a freshman at this point. And I remember not being the most intrigued, to be honest. I was just kind of like, okay, sure. So first year comes and goes, sophomore year happens, and I'm really starting to tell myself, let's figure this out. Let's, what do you think you want to do? My mind was always kind of torn within medicine more than anything else. And then I was taking my sister to an orthodontist appointment one summer when I was home, and I'm sitting in the waiting room, and I kind of just have a light bulb come off my head, and I think, hello, you're sitting here, you haven't really truly looked into something like this before, go ahead and ask. So I go up to my orthodontist and I say, hey, can I shadow you for the rest of the day? I have some free time and I'd love to just see what your day is like. He's like, of course, come on, hang out. So I spend the day with him, and I'm watching everything ortho does. It's very hands-on, it's very interactive, lots of patience. It was a good experience overall, and I thought, this is really cool. I think I'd enjoy this. So I tell him, and I said, Dr. Mariani, this is great. I think this is what I'm going to do. I think when I go back, I'm just going to focus on ortho. And he's like, all right, well, hold on there, slow your roll, because in order to do ortho, you have to go through dental school first. And so that's how little I knew about dentistry. I did not realize you have to do dental school and then go into the specialty. I thought it was kind of a straight on through if you want to pursue a specialty within dental. And so he's like, why don't you go shadow your general dentist while you're here, since you have a few more days. So I went ahead, I called my general dentist. I asked her if I can hang out. She said, yes, please. And it was such a crazy experience because the more I watched what she was doing, the more I learned about the career in general, the more it made sense for me as a person. I remember thinking, oh, this is very meticulous work, very, you guys have probably heard this before, but dentists will always describe themselves as very type A people. This is extremely type A kind of work, very, very detail oriented. And there's that's, to me, such a beautiful aspect of it is the connection that you have to make with patients. More often than not, you have someone walk in and one of the first things they say to you is, oh, hi, the dentist. And it's like, oh, it's nice to meet you too. And I think that challenge of earning trust and helping all these different patients overcome that fear of what we do every single day is a really special skill that you have to have in order to be successful. But it's the most rewarding feeling because at the end of the day, we really are making a difference in people's lives. Not to sound so dramatic, but we all can agree everyone does value a smile. And you've probably seen that funny meme where it's like, what's the first thing you notice about this person? It was the missing tooth or the missing eyebrow. And so I think that always just is such a true or not concept, but true point to understand is that what we're doing is allowing people to not only smile, but speak normally, eat normally. It's, what keeps us alive, truly. So it's a really special thing to be able to make people understand how much you care about it, and then it makes them care and become just as invested in their oral health as we are. And so that was it. If that wasn't clear enough, I kind of became a sucker for dentistry. Like, this is beautiful. This is what I'm doing. And I told myself, when I get back to school, I'll stay with PPMS, but I'm going to kind of hone in on and focus in on dental. And so when I went back, I joined PDSA, which is the Pre-Dental Student Association. And that was amazing. That really kind of kickstarted for me what's become a lifelong involvement in organized dentistry. Literally to this day, I'm still involved. And now moving out to Philadelphia and being a resident, it's very different than being in dental school, but I still made it a point to stay involved with the local dental county society, which every city has one. We can get into that a little bit later. But point being is, coming back and jumping into leadership positions was so crucial, I think, in being successful in getting into dental school. And in my talk today, I'm really not going to get too into the application process with you all, because admittedly it's been a while and I know a lot of things have changed with it. But for the most part, I can tell you that there's a few fundamentals that will always stay true, that within academia, that the deans want to see, that faculty want to see when you're interviewing. And of course, the grades matter. Of course, the DAT matters. There's no secret. Is that the only thing that matters? Also, no. But you do want to do well on those. So I'm not saying don't worry about that. By all means, please worry about it. Please try your hardest and do the best you can. But also make yourself stand out. And I know that sounds a little corny and cheesy. A lot of people say that, but it's true. And it is in small ways. It's not, you don't have to go and invent the new, the next modern toothbrush that you don't even have to hold it with your hands. I mean, that would be cool, but that's not what they expect out of you. They want to see you do more, meaning leadership. So for example, I mentioned here, I was director for both PPMS and PDSA. And within those roles, that's when you kind of get to show where you stand out, to be honest. So it's one thing to write on the applications that you got, the perfect score in DAT and you have a 4.0 and you're directors of these three, of 5 or 6 clubs. That's great. So what did you do as a director? Oh, I attended the events with everyone else. I mean, that's good. That's great. But did you do anything? And so to give you guys a better example, what I mean is, not only were you a director, so for example, in my case, not only was I director for PDSA, but I also wanted to make sure that we had a presence at a very big event. Most colleges have this, like the dance marathons. So ours was called Nighthon, and I thought, PDSA is such an awesome club, but they don't really go out, and Nighthon was a big deal. You see, if your organization is there, that means you're a pretty active organization and you get to meet so many other people. So I made it my goal to increase our attendance and to bring as much money in as the club ever has. And that's where the standout part comes in. Because now my application, I get to say that I did that. I was the person who not introduced it, but kind of grew it. This is how much money we were able to produce because we were pushing. I created this new fundraiser event. And those little things are what's really going to matter in the interview. Because look at how easily I was able to tell you about my experience doing that. If you send an interview and they tell me, so tell me about yourself, and you just say, well, I was director for this and we went to events, the conversation's over. But if you get to get really excited about, oh, actually, so when I was a part of this club, I didn't realize they weren't involved, and then yada, yada, and you go on with your story, even they're going to be intrigued because you care and you're talking about it passionately. And those are little things that are really going to set you apart from other applicants. So that's my little I feel like I just went off on a tangent there, but that's my little tidbit on application advice. That's what I felt made a big difference for me getting into dental school, and even once I got into dental school with other things I wanted to be involved in, and going out and getting into residency. So let's move on. Okay, so dental school. So for dental school with NYU, it's the largest dental school in the world, probably one of the most expensive as well. Like you all know this by now, but dental school is unfortunately not cheap. And I'm going to also try to knock off on a tangent on this, but going back to organized dentistry, that was something important to me coming in, was having control of my situation financially, because we're not going to get a lot of training, unfortunately, as dental students, or you didn't, or I didn't. And it's daunting to know that you're going to come out owing $500,000, sometimes more, maybe a little less, maybe even more. So what power do we have, and what can we do? And that's why I felt that NYU was such a great place to be, because we're the largest school, and we're one of the culprits, if you will, of the issues. I had direct communication with these deans, with these faculty, the people who are there day to day and see what we're going through, and being able to speak to the changes. So I got involved a ton in my class. I've always kind of been that person that likes to have kind of, like kind of have a taste of everything, if you will. And I loved the aspect of a huge school with a lot of different representation, a lot of different organizations. That to me is worth volumes. I mean, the networking that you get is first and foremost, right? You make some lifelong friends, meet some incredible people that can make a difference in your professional life, but also your personal life. And secondly, that means that you get to have options that cater to all the different interests that you have. So ASDA, you guys have probably heard of it as the American Student Dental Association. That's every school has a chapter, and I held quite a few positions as soon as I got into NYU. I thought I want to get involved right away. So I was our organized dentistry liaison, which basically as the communication, I was the communication between dental school and the local dental society, so that they know what's happening on an academic standpoint, what we're learning about, what problems we're seeing. And then I get to see, from a student perspective, what's happening in the real world. What are those issues like? How are they handling them? What are they doing for us when we get out of school? All those things matter, and those are things that we really should be thinking about right away. Then from there, kind of just climbed the ladder, secretary, then I was president, and then I was our senior advisor. And as is amazing. I mean, the leadership is a huge pillar of what they focus on. Another one's advocacy. And that to me was so important, because that's where we need to focus our attention in order to address some of these problems we're seeing, most notably right now, for example, student debt. It's a huge issue. It's not just an NYU problem or a Penn problem or any other dental school. I'm naming my own, but most schools have this issue. The problem starts with certain laws that are in place. Why are schools allowed to charge whatever they want? Maybe instead of saying, yeah, it's okay, you're charge whatever tuition you want, and students can borrow whatever they need and then they pay back later, maybe the government has to step in and put a cap and say, you can't charge more than this for a student. This is how much they're allowed to borrow. That's one resolution that we've suggested. Maybe you shouldn't be charging interest when they're still in school. They don't have jobs. They can't pay it back. Another suggestion. These are all things that through ASDA, we're able to, on a large scale, speak to these representatives. I literally was in Washington, D.C. on the Hill speaking to representatives from New York that didn't even know this was going on. And so to have that one-on-one FaceTime and explain to them, these are real issues, these are problems that we're going through. We're getting into a career to serve our people, to serve the citizens of your country. You get kind of talk the talk with them, but tell them this is for the people that we all serve, and you're putting me in you're boxing me out, because now how am I supposed to pay this debt back? There's a lot of places in the country that are underserved, and it's because dentists can't go out there because they're not going to be able to afford to live because they have loans to pay back first. And so in being involved in these large organizations, you get to kind of be that voice, and I think that's so important. So if it's not clear enough to you all, join your ASA chapter. Regardless of what school you go to, you're gonna have a great time. It's also so much fun. I made, again, lifelong friends there. We have some great conferences. We go out to different parts of the country, and it's always a good time. It's work hard during the day, play hard at night. It's, trust me, you'll thank me later, but be involved with ASA. A few more here. So the Dental Economics Club, I was secretary, and then I served as president for a couple of terms. That was a really cool club because, again, you don't get a business background in dental school, unfortunately. So, and as I mentioned before, I came into school knowing this is not going to be cheap, and I need to have a grasp on how I'm going to handle this situation. And so, being involved in that club exposed me to the financial side of things, to the business side of things, and gave me an opportunity to dive in and do my own research, because then in taking on a leadership position, I had to be the educator in a lot of ways. And so that was very helpful. I really had a great experience with that. I can't say that all schools have that club. I think they should. I think if that intrigues you, then you should just start it if the school doesn't have one. But in any event, start taking the time to get familiar, because that's one conversation I've had with friends that come out that don't go corporate, that are private, that they say, no, there's no way, like, how, I can't believe they didn't prepare us for this. I feel very lost. So that's almost sometimes the harder part than the dentistry. You'll hear that even from people that have been practicing for years. They say, oh, the dentistry is the fun part or the easy part. It's running this business. And that's what you'll be, a small business owner. So it's something to keep in mind. And then I was also involved in a class council, alumni relations, and I did a bit of research. I've done research even since undergrad. I guess to backtrack a little bit, I think research is also a strong point to have on your application if possible, just because it really shows that you value evidence-based practices. It shows that you value understanding how to either where something came from or how to make it better. I think fundamentally, if you care for those things, that is what dentistry is. It's constantly evolving. I'm not sure how familiar you all are yet with like materials, what have you. But for example, amalgams, which are like the silver fillings that people used to put in, and now we mostly obviously prefer composites. I mean, they don't even they basically are doing without amalgams completely at this point. But composites are the tooth colored filling, something like that. That's all through research, all through learning what else can we use, what else works better. And we wouldn't have gone there without having the people that cared to do that, take the time to look into the science and do the research. So I'm a big proponent of getting involved with that if you can. And then one last thing for the alumni relations, that was another awesome opportunity, I think, to meet with and to network a lot more with the alumni from NYU, at least, because it was pretty incredible. I would go to these luncheons, and there were people that just graduated. There were people who were 70 years out of practice. Literally, I mean, this woman was like, I can't believe I'm even here, but it was really cool. Really good experience. So if you guys are into that, I would suggest getting involved with alumni as well. Oh, and also just a little tidbit on NYU. I personally had such an amazing experience there. I love the school. I'm happy to answer any questions about it. The good, the bad, the ugly. I know a lot of rumors can go around about any school, really, but from my experience, it was the best place I ever could have been. I would do it a million times again, even if it cost the same. I don't know that I would double up the debt, but I would pay for it the same price again. And it really was, to me, what made me so passionate about dentistry, or kind of reinforced and really made me realize why I love dentistry so much. Okay, so just a little aside here, kind of been jumping around a little bit, but in terms of tips and advice, I feel like time management is the main thing. I kind of just went on about myself for a little while there, and I think, if I was all in a room with you, you by now I'm sure would have gotten this question because I get it all the time, is how do you have time for all that? Or how could you be in so many things? How do you stay so involved? It's time management. You have to, you've got to plan it out. I'm a big planner of like my days to the hour planned out. So maybe that's a little crazy, but it's worked for me. So I just kind of stick to it. And I feel that I do better when I have this structure in my head. Because, for example, if I know that I have an exam on Thursday, right? And that's a bad example. Let's say, okay, today's Wednesday. I have an exam on Friday. And I also have to do, I'm going to act like I'm a first year dental student. I have to go to the lab and practice 2 preps. And then I also want to go to the gym because you need to take care of yourself. I mean, in life in general, but definitely in dental school. And I want to, maybe I want to go out for dinner with a friend that I haven't seen in a while. There's no way I'm going to do all that without saying from 6 to 8, you need to study. That's it. There's no ifs, ands, or buts. You need to study. And you need to get to school. And then from 9 to 10, you need to go to lab. And you just need to stay. I know sometimes easier said than done, but for the most part, I feel like when you give yourself these time constraints, it makes you focus in even more because you know that, okay, I need to get this done. I can't, mess around right now. And that's kind of what's worked out for me, is just have the hours. And I'm also really big on starting early too, I will say. Right now I wake up at 5:30 and I've kind of moved my routine around a bit. So I wake up at 5:30, started doing yoga recently too. So I'll do yoga in the morning. And then if I have time, I'll try to read a little bit if I have any lit review I have to do. And then I'm with patients all day. So residency schedule is a bit different, but it was the same idea when I was in dental school. It was the same plan it by hour, and you'll get it done. And, it's kind of like the triangle thing that you used to see in college, like you can only have 2, and it's like study, party, sleep, I think. And I don't sleep much. Well, we can say that, but I'm enjoying myself, and we're getting the work done. So I think it's rewarding to plan your days in that way. All right, so let's jump into why I decided to specialize. So periodontics is the dental specialty focusing exclusively in the inflammatory disease that destroys the gums and other supporting structures around the teeth. A periodontist is a dentist who specializes in prevention, diagnosis, and treatment planning of periodontal disease, treatment of periodontal disease and in the placement of dental implants. 3 years of additional training after completion of a 4-year dental program. So for any of you who are still awake after hearing that, you might be asking yourself, why would you want to be a gum gardener? And if you haven't heard that term before, it's a joke. I also recently heard glorified hygienist, gum scraper. The jokes go on and on. But the teasing comes from the idea that we focus on the maintenance, if you will. But the thing for me is that why I love perio is because it is the foundation. You don't get to do your dentistry unless the gum and the bone is healthy, because guess what? You won't have a tooth to work on. So it really does start with us. You need to have, and the patient education, it starts with making them understand how the mouth works, how the body works, all intertwined, and making sure that everyone's on the same page so that when you do your dentistry, it's good, very beautiful, great dentistry, but it's going to last too. Because that's great that you can make a perfect veneer prep, but this person doesn't brush their teeth and they like to, I don't know, open beer bottles with their teeth. So your veneer is probably going to break. And that's really, all part of some of the base, where the baseline starts is with perio. I think that it's also the most closely related to medicine in terms of understanding the biology behind it and how the systemic components and how they all are intertwined. Immunology is a huge part of perio. I didn't realize until I got into it. It's so important, is understanding, again, your systemic health and how it relates and how much it can affect the health of your mouth. It's incredible. So I can talk about it all day, obviously, but those are some of the reasons why I really love it. And I think that I've noticed that a lot more people are becoming more familiar with perio, which is such a good thing, because that means that people are valuing their mouth and asking more questions and being educated more properly. Because when I first would say perio, even just a couple years ago, most people were like, what is that? And now I would say 75% of people would say, what is that? Now it's like 50-50 actually, which is kind of nice. So hopefully one day we'll get to 100%. Everyone knows what a periodontist is, but in the meantime, we're baby steps. And then last but not least, the best part is the surgery. I had no idea how heavily surgically based perio was until I was in dental school. And the moment when I realized it was the moment I decided that this is what I want to do. So every school does this a little differently. The way that NYU did it was, as a third year, you'll be put into the periodontics department on a 1 week rotation, an entire week, every day, 8 to 5, with the resident. So you really get to see what the life is like from a resident perspective, at least. And I was already kind of familiar with perio through classes, but like pretty much anyone you ask in dental school, they at first say they hate perio. And most people continue to say they hate perio. Only us that decide to pursue perio say we love it. But I was that person. The first 2 years, I remember thinking, oh, this is like so sciencey, and this is so heavy, and they're so serious about perio. Like, what's the big deal? But now I get it. It is a big deal. And I'll say it one more time. You don't get to do great dentistry without having good perio, or great perio. So it really does start with us. But anyway, so fast forward to third year, and I've been talking to one of the residents who I was friends with, because he was a dental student at NYU prior, and then he stayed on for perio. We were talking about perio in general, and he was kind of giving me like tidbits about his experience, and just give it a shot, or you'll see it. I say you'll see when you do your rotation, and then you let me know what you think. And the week happened, and I was just blown away. I can't say it enough. I had no idea it was so heavy with surgery. I mean, so I have it listed here, but the things you see are implants and augmentations. So meaning trying to grow bone, grow soft tissue plastics, which is like gummy smiles, so gingivectomies, or you have recession here. We want to bulk that out. Different procedures. There's quite a few, and a lot of different techniques and ways to do it. So that's exciting and extremely challenging too. So I think that's something that kind of keeps you on your toes with perio. And I definitely am enjoying it so far. And I mean, I know I will forever, but these were the reasons and the things that kind of made me say, wait, I think I do want to spend another 3 years and only do this for the rest of my life. I love it that much. And I was fortunate because there's different honors programs, and at NYU I was selected to be in the perio honors program. So as a fourth year dental student, it's essentially like a mini residency. I did some courses, I did some lit review, and then I was able to do perio surgeries the second half of the year. So that was a lot of fun. So this is just a little table that I thought I'd share on the different specialties. This was from 2015 when they did this study, but just to give you an idea of salaries. So at this point, at least, the red line here is perio. The national average was about 291, which really I think is a very nice number, especially if you borrowed over $500,000. And let's say you borrowed over $500,000, you come out general and you're making like maybe 160, 175, or you come out owing, again, a little over $500,000, or maybe closer. Maybe now you're getting closer to like 6.5 or 650, but now you're making 3. That 2-to-1 ratio is a lot nicer than that 2.5 or 3-to-1 ratio of what you borrowed versus what you're making. So I think that's something to consider as well from a financial standpoint. So residency. I don't know why I ever thought that it would be a little easier, a little more relaxed than dental school. No, definitely not. It's exhausting, to be honest. It's long days. It's usually 12-hour days at the minimum, Monday through Thursday. Friday's always a little lighter, but it's just kind of the name of the game. There's a lot going on. I think COVID made it a little longer, but typically for us, and when I say all this to you all, this is me speaking from my experience at Penn, and it's great. I mean, I'd rather be busy. I'd rather have the amount of patients we have is incredible. The types of cases we see, so diverse. So I wouldn't trade it for the world, but it is tiring. So, you have patients in the morning, and then we have classes a couple nights a week. And then I also am getting my master's. So there's some additional classes there. And then on top of it all, you have different just different administrative stuff to take care of, if you will. So, you get a patient roster. I have to call the patient. I have to schedule them. I have to deal with like financial things sometimes. I have to, if they're getting implants, I need to run around the school chasing everyone to get these implant order forms. If you need certain materials prepared before, there's a lot of little things that you're not really told about and that you don't realize they take time, and it adds up, even though it's maybe only 10 or 15 minutes more. But that if you're doing 10 or 15 minutes more, 5 different things, there goes an hour of your day that you could have been studying, you could have been physically working with a patient. But again, that's just kind of the way it goes. And I will say one of the nice parts about residency is the autonomy. It's a lot more of a conversation, if you will. Not to say that in dental school that you're just being barked orders out or being told what to do. You kind of are, but here when you're talking to an attending, it's collaborative. It's, what do you think? Well, why do you want to do that? Okay, what about this? You're not asking for permission. You're not saying how. I mean, you could. So, sometimes you want to be, especially in the beginning, you might be like, no, tell me how to do this. I've never done it. But at one point, it starts to switch, and now you're just talking with a colleague, saying, this is how I think I want to approach this. Okay, go ahead. Let me know if you need help. Which I really do enjoy that. So that's been a lot of fun. And I feel very lucky because my group is so special. I mean, we have so much fun together. Everyone's joking. It's this very interesting dynamic in the clinic. There's a lot of different types of personalities, and I feel like it could be a TV show. It's a lot of fun. We're always laughing at. I'll say that. So make the most out of it. Wherever you are, have that mentality when you go in that it's not going to be easy, but have fun, because this is not. You can't just be looking at the finish line all the time. You got to also bring yourself back to the present and think, no, wait, hold on. I chose to do this. Let me enjoy this. Let me laugh at this moment right now because I'm stressed, but you know what? How can I make this funny? How can I brighten this up so that I don't feel miserable at the end of the day and drained? Those days will happen. It's not all, sunshine all the time, but I think that mentality is half the battle. And so if you kind of reinforce that and think that way, it's going to help make any experience a lot more enjoyable. So I kind of just talked through this, but this is kind of what my days were like. Now it's summer, it's died down a little bit, thankfully, so I won't have as many classes, at least for the next couple months, but it was pretty long days for the last year, basically. All right, so now I just want to walk you guys through a case here. It was mostly a pretty typical first year case until right at the end there, I got pretty lucky. But a lot of times what you'll see is a tooth has to be taken out. And in perio, we do ridge preservation, which means the tooth comes out, we put a bone graft in, because the idea is that we're going to replace this tooth eventually, or the space rather, with an implant. And we want to preserve it. And all the study and literature supports that doing ridge preservation techniques and using grafts makes the site a lot more predictable in terms of how much bone you'll have, versus just leaving it alone, and then you run the risk of too much resorption, defects forming, needing an additional procedure, things like that. Also, I'm going to try my best to keep this in layman's terms. I know that there might be some of you that are not familiar with any of this at all, but if I do say anything and you don't know what it means, please ask me at the end. I'll clarify it. So basically what happened is this gentleman shows up and he's one of those patients. He needs a tooth pulled, needs an implant later. But based on a lot of different factors, but most notably the health of the tooth that's being taken out and the quality of the bone, sometimes you can place an implant in right away. And in this patient's case, he did have a healthy tooth that just happened to fracture at the crown portion. So quick little dental lesson for you guys if you don't know it. Tooth has a crown and the root, so the crown portion fractured off, and he had enough bone, but only if you put the implant in a certain direction. And implants, a lot of times we have to plan it knowing a crown's going to go here. So just because you have enough bone over here doesn't mean that, okay, good, I'm going to put the implant there. What if over here is out by the tongue? We want the tooth that goes on the implant to line up with the tooth above it. So this is useless to us. We need more bone on this side. So this patient had a case where he almost had enough bone exactly where we needed it, but not quite. And so there's a really cool implant system called Southern, this one that I wrote it here, coaxis, where you can place the implant in such a way that you can move it out closer to the front of the what's called the facial bone, and still have the axis, meaning the part where the crown attaches, a little further back where you need it. And that way you save the patient from needing that additional procedure of having to augment and do some sort of bone regeneration there. Excuse me. So, all right, so here's a pre-op. This is tooth number 7, which is a lateral incisor. So this is the right side of the patient's mouth. And I'll kind of talk you guys through some of the terminology just so you can get more familiar. But this would just be considered a facial view where we can see the front of the tooth, and then this would be, the one on the right would be considered an occlusal view. So we went ahead and took tooth out. I did it, what would be called a minimally traumatic extraction. We have a lot of nice fancy tools, as my OS friends call it, in perio, because, you know, we like to take our time. We want to preserve whatever bone there is. We want to maintain the soft tissue as best we can. And so we have a lot of micro instruments, and that goes a long way because it, again, tooth is going to come out just the same, but we're also going to protect everything else around it. Versus sometimes when you use these bigger instruments or try to work too quick, you end up potentially breaking other things, tearing here and there. And that's one other thing I love about perio. It's very artistic surgery. I'd argue, to be honest. It's very pretty to watch. It's very nice compared to some other situations. So tooth is out here, and this is number 7. So we can say it's slivered intact. You can confirm that when you take a tooth out by just feeling the bottom of the root, and it should just feel very blunt and soft and smooth. And that's how you know the whole tooth is intact. If you felt like a sharp edge, or if you just see that it's, or you can see with your eyes visually that it's broken, then that means you got to go fishing now in that tiny little socket for that last piece, which is not fun. So try to get teeth out in one piece if you can. Okay, and then here's implant placement. So tooth comes out, implant goes in, and just, I don't know if you guys can see my cursor, but I'll use it anyway. So basically, he had enough bone on the outside, like I said, the facial side going toward the lip. He had enough bone there. But if we had placed the implant, a normal implant there, then the crown of the tooth would be sitting out over here, if you can imagine that. And we don't want that. We want the tooth to be sitting here so that it lines up with what's called the cingulum of the adjacent teeth. And when the lab makes a crown, it fills in that space nicely, just like a normal crown would. And that's the beauty of using the system, is that we can go ahead and place it where we need to place, where we make sure that the implant is in bone, but still restore it, meaning place a crown on it where we want the crown to be. And then here's our final radiograph, just to confirm seating and how where placement was, and we're very happy with this from a restorative standpoint as well. That's a whole other conversation, but we can get into that another time if you guys ever wanted on considerations for when you're restoring an implant versus placing it and what have you. And then this is how the patient was able to leave. So here, we're retracting his lips, you can't really appreciate it as much, but he basically, came in with a tooth and left with a tooth. It looks like, because he has what's called a low smile line. So when he smiles, you wouldn't see any of this part at all. His lips kind of stuck right around here. Meanwhile, implants right here, his temporary bridge is cemented, and it's very happy guy. So it was good. It was a really good experience. This was probably one of my first cases when I got into clinic. So the seniors were not super happy with me, but I think we're okay now. I think we're on good terms. So it's just one of those things where it's a cool case, and not everyone, everyone gets to do them, but they're not common to see. So that's why at first they were kind of teasing, saying, you just got here, what's happening? But anyway, just some final thoughts before we wrap up here. I feel like you've all, I've said this a few times throughout the talk, and you've all kind of gotten this, the gist of it, but seriously, remain positive. It's a very challenging field. It's very stressful. It's exhausting. I'm not going to try to sugarcoat it or make it seem like it's anything less than that. No, but that being said, nothing worth having comes easy, and it's going to take a lot of hard work, but I think you're going to feel so proud of yourself, and you're going to be so happy if you truly love dentistry, with kind of sucking it up now and getting through the brunt of it to finally come out and be able to pursue this career that you love, and every day to spend your life doing perfecting this craft that you've kind of built this skill set for. And again, don't forget to take care of you. You go to the gym, you eat well, call your loved ones, go on trips if you can. I know budgets are tough, but like even if it's just a little weekend getaway, take care of yourself. That to me is so important. I think that's another part of what keeps me going is the balance of work life. I'm a big proponent of it. I'm all about spending 48 36 hours in however long I need in a library to study for this huge exam. But right after that, I'm probably gonna go have a nice meal. Maybe I'm gonna go grab drinks with my friends. Maybe I'm gonna go on a little trip, something to reward yourself, because that I think is what's gonna keep us going through. And then lastly, I would say hard work does not go unnoticed. This time and time again has been I think it's such a nice feeling, and I think that I've had these really great experiences throughout my career so far as a student and as a resident, where you're pardon my French, but you're busting your ass, and not that you think no one's noticing, but when someone goes out of their way to say something positive, then it really feels worth it. So that's all I had for you guys. Feel free to throw any questions my way, and then if you ever want to reach out to me, there's my Instagram account and there's email as well, so feel free. And thank you guys for your time.
Thank you so much for that amazing presentation. We do have some questions in the chat that I can ask. So the first one is, what type of dental related research did you do? So I guess also undergrad, because you mentioned both. So what was that like, and what were the topics?
So actually, I didn't do any dental specific research in undergrad, and arguably in dental school. I guess no, it was okay. I'll just answer by saying what I researched. So in undergrad, I actually was doing research with my physics professor. It was really cool. It was actually funded through NASA, and it was this like crazy project on Saturn's rings, because he was like the Cassini guru. Like he knew everything about it, and his whole thing was form planet formation, and the theory that either a planet bursts from a star, or that really tiny particles aggregated together over time and form these huge planets that we now inhabitate one of them. So that was my research in undergrad. It was all space related, and it was fun to talk about in my interview actually for dental school, because they were like, well, how is this relevant? How do you think that this can be applied to dentistry? And I had to talk with the dentist I was shadowing in Orlando, and I came to find that the principles of the composite material that we use, so the filling material that we use in dentistry, is this very similar mechanism, if you will, as the theory that we were saying with planets forming from smaller pieces and sticking together. So that kind of worked out well for me. And then in dental school, I did, it's more of like behavioral research. I was looking at dental fear. And this is really cool. It's an ongoing project. So I started at NYU, and then our dean went to Penn, and now I'm at Penn. So we're still doing that project over at Penn now, and it's going really well. So that's been fun. But for a true dental or true perio research, I'm doing that now with some of my attendings, and we're looking at a couple things. One is looking at regeneration procedures, so using grafting and different biological materials to regenerate any area that might have bone loss. And then PRF, which is platelet-rich fibrin, which is when we take the patient's blood, our own blood, centrifuge it, and that has a lot of wound healing enhancing properties. And so we use that to make sure that the patient has a good, the most ideal outcome in their healing. Long story short, I can also talk about that for too long. So.
That's super cool. So you said that you went to NYU and now you're in Pennsylvania. So what are some immediate things you noticed between the two dental schools, and like versus like what they value, maybe their way of teaching, and which style did you like better?
That's a fun question, because to be honest, maybe it was just coincidence, but a few of us from NYU are at Penn now. So my dean went to Penn. Like 3 of our group leaders from NYU are at Penn. Me and one of my own co-residents are at Penn now for perio. Someone from Endo. So people joke and say that Penn is like the new NYU because of the dean. I can see that he brought over some values that he had over there to Penn. In my opinion, he brought the best ones. So there were things that weren't being, that he got some pushback for. And I think people just didn't see the value yet because it was new. And sometimes people see new as not threatening, but no, I don't like it. I don't want this change. But that being said, I loved both schools, and they both have their things that I would change as well. I can't say that I have a preference for one or the other. I just think that something that influences the program that I noticed was that NYU was a heavy karyology school, and Penn was a heavy periodontics school. Sorry, guys, it's been a long day. It's a heavy periodontics, or was influenced heavily by periodontics. A lot of periodontists started at Penn. Arguably, the specialty started at Penn. Perio did, so, which is really cool from a historic standpoint. But yeah, I can't say I can pick one or the other. They're different in regards to how they view the specialties, not in a good or bad way. I think that's how I can say about the different styles.
Gotcha. So someone asked, what did you major in during undergrad? And I guess to go along with that, like, I know you mentioned you were into the medical field, but what kind of helped you make that decision before going into college, or even during?
The medicine portion, or?
I guess your major and then also medicine.
So going into, I knew early on that I wanted to do healthcare. I knew that at the very least since I was probably 5. I think I can say for sure, because I was actually talking to my mom about this the other day. When I was like 5, I was just in love with my pediatrician. I was like, I want to be here when I grow up. So I think I wanted to do peds for a while. And then as I got a little older, the more I learned about it, the more I thought, no, this isn't so fitting for me. I don't think this is like, something I want to do, but I do like medicine. And then I really thought orthopedics was great because I had an injury and I had to see an orthopedist and I had to do PT. And I was like, oh, this is really interesting too. And my stepdad's a nurse, so I got to see a lot of cool different departments because he was in ICU for a while. He was in cath lab, he was in cardiology. So I've seen a lot of background in healthcare in general. So going into undergrad, I knew, okay, I definitely want to do something in medicine. And then so I decided, knowing that going in, I decided to major in biomedical sciences and health sciences. And I just did a double major with those two because they had a lot of overlapping classes. So it worked out.
Yeah, makes sense. So someone asked, if you're a non-traditional student, what are ways you can stand out? Do you recommend doing a post-baccalaureate program?
So I can't speak to that too well, I think, because I know that from my understanding, like, for example, if you're getting your major in, I don't know, musical theater, you have to go out of your way to take all the prereqs for what the dental schools want. And that's going to add time. So the question becomes, well, do you just do those on the side with your major, or do you outright go and do post-bac and get like some sort of science degree? I think you can argue that if your grades weren't so great with the one major, then maybe just do the post-bac and bust your butt and focus on the sciences. If it works out where you can mix in these prereqs that you need with your current major, then, and it doesn't hurt you and it's not going to add much more time, then maybe that makes more sense. But I say for standing out, the fact that you are non-traditional is your standout. You get to go on and on about musical theater, and that's so refreshing for the people in the dental school for the most part, because we love teeth, but it's kind of nice to talk about something else too once in a while, and somehow it'll turn into a conversation about teeth. I guarantee you, because I don't mean to do it, and somehow I feel like I'm just always talking about dentistry. So
gotcha. So someone asked, this is I guess more geared toward this one person, but she says, I just graduated from a small private college in which pre-dental, pre-med programs were not offered. Other than shadowing and holding leadership positions on campus, what else would be valuable?
It's a good question. I mean, maybe getting your license to be a dental assistant, or
right.
Hygiene, something like that. That's a good question. Yeah, I guess being a dental assistant could be really valuable.
Yeah, and I know some dentists offer like without you having to like get a license, maybe like an internship. So that might be something. And I think it also really helps you get familiar with like the tools because you're kind of forced to be put on the spot.
My friends that had an assisting background were leaps and bounds ahead of all of us, so it's to your benefit for sure.
Yeah. So when asked, what are ways you think pre-dental and dental professionals can build their network?
Pre-dental. So ASDA, for sure, they have a pre-dental chapter, if you will. So yeah, I guess that's the right way to phrase it, pre-dental chapter. But in any event, we had pre-dental presence at all of our conferences. So I would say ASDA first and foremost, because that is amazing. You get to now meet people from every school. That's huge. That's the best way you can network. Aside from that, going to whatever local dental schools in your area, if you have one, just spending time with them. I think that's another good way to do it.
Roger, are you still involved with ASDA? Is there a way to be after dental school?
A little bit, not in a way that there's some active title that I have, but there's open door policy, if you will, with me. So my chapter at NYU, if they ever had questions, they would just ask. And friends of mine in other places, if they had questions about how I did this or how I did that or whatever it is, you just reach out to me. But I can't say there's like a specific position once you get out. It's more of just lifelong mentor because we had that that relationship together.
Gotcha. So you mentioned debt. And so would you believe that, like, how much do you think prestige holds a factor in choosing dental schools when it comes down to, I guess, financial, like the debt you'd be in versus like the prestige that school holds?
I think that is relevant depending on what you want to do. So if you know, and there's nothing wrong with any of this, by the way, let me just preface that. Like, this is not, I'm not saying this in a good or bad, right or wrong way, but to be candid, if you know that you just want to do general dentistry and go work back home and you live in a small town, you should probably go to a state school and spend the $300K, not the $600K. If you want to go into a specialty and you want to be an academic, you want to be an international lecturer, you want to be the person that everyone goes to listen to when they go to conferences, the prestige does hold weight. It really does. That, more than anything else, because it was earned, right? A lot of these places, there's a reason why they're so notable, and it's because they probably were the places that developed certain techniques, or that famous dentist came up with that material. That's where he came from. That, I think, speaks to the work ethic, the values that they have in research and evidence-based dentistry. That is what the weight of that prestige holds. So I guess the answer is it depends, but those are, I think, the two ways to look at it.
Yeah. Okay, so kind of keeping going with like the debt. So what do you think the financial pros and cons of residency for specialties are, like during residency, not so much salary after?
Sorry, say that again.
So like the cost of residency versus if you get paid, how do you think,
how it works out? No, I mean, it's a loss for sure. Not only are you not producing, but you're also paying, well, some programs. That's something I didn't talk about. So there's actually a lot of residency programs in dentistry that you do get paid. It's resident salary, but it's a salary nonetheless, which is nice. Mm-hmm. At least you're not paying for the school. Yeah. Some are not like that. Perio has very, very few programs that have a salary. Most of them are tuition based. For me personally, like that was something to consider, of course, but the places that offered salary, except for one, I could never see myself living in, and location to me is very important. I need a city. I need a busy lifestyle. I don't do well with the smaller, kind of laid back dynamic, if you will. So that's something that keep in mind. That being said, to answer the question, it kind of goes back to the point I was making with knowing what the potential salary is. So yes, I'm in the hole for. I'll give you guys my situation. I'll be very, very honest with you all. I came out owing like 480 something from NYU, and by the time I'm done with Penn, it's going to be close to 7. Not only that, but I just lost 3 years of potential general dentistry salary, which is, let's assume it's 150 to make it easy, so 450 that I'm out. But presumably, I get out of school, and that person who did general started at 150, maybe 155, maybe 160. They come out, or 3 years later, they finally hit the 170 mark, let's say maybe. I come out and I start right away at 350. Wow. So what does that mean for me in 3 years and in 5 years, and if I open my own practice? So you have to look at that cost analysis and think, short term, yikes, that's a lot of money, but long term, I'm going to be making significantly more money, so I can afford to be in school this much longer since I will be making that much more later. And that was my rationale behind it. And then another thing that's really helpful that is going to be a saving grace is the repayment programs that we have. So that's its own lecture as well. I would give this one all the time at NYU for the Dental Economics Club. But we have a few different options if you're borrowing federal loans, which I highly encourage you only borrow federal loans. But the repayment programs are meant to help with relief, because is it realistic for someone to come out owing $700,000 but only be making 100 something a year? No, you can't afford. You literally can't afford it. And so these programs are in place to make it a payment based on your discretionary income versus what you borrowed. And that's the whole idea. So that's pretty much my plan when I come out will be using a repayment program so that my payments are minimal while I get on my feet, get established, and then navigate it from there.
Yeah, makes sense. Wow. That's definitely like something to weigh, right? If you value, like, you know, if you think you can handle doing education and you're motivated versus like the salary and being content.
Yeah.
So I think
like the specialty, I think is huge. I mean, don't do it for the money. It's enticing, but by all means, if you hate blood and like the thought of cutting someone's gums open freaks you out, probably shouldn't do perio.
Yeah. So I think we have time for one more question, and I do want to gear this more towards your specialty and what you like to do. So what is your favorite procedure versus your least favorite in your residency, in your specialty?
Good question. If any of my attendings are listening now, they would just shake their heads at me. I can very easily answer the second question. My least favorite is osseous, which no one probably even knows what that is. This is like old school perio. There's deep pockets. It's 1950. Cut away more bone. That way the gum recedes, and now they can keep it clean. That's what osseous is. And it works. There's plenty of studies, and it works. And I do it. We still do it. It's just, I'm more in favor of maintaining, and regenerating. I think that it's 2021. We have so much knowledge. We have all these different materials, all these different techniques that we've come up with. The graft materials we use, they're constantly improving and enhancing how much more effective they are. So I lean on that side of regeneration. That being said, I'm torn for my favorite procedure between extractions and implants, because they're both really fun when they go well, but they're both really frustrating when it's a tough case. So yeah, I'd say it's a tie between those two.
Gotcha. Well, thank you so much, Dr. Allison, for such an amazing session and kind of really being honest with us, because I think that's sometimes what we need to hear, because we can get lost in like the end goal and forget to think about, the journey. But everyone, you can follow Dr. Allison on her social media or just email her, and I'm sure she'll be happy to answer questions. And if that's it, bye, and we'll see you guys next time.